Good evening from New York. I'm Selwyn Collins, your host of CWS As It Is. Thank you for joining us. Those of you who are joining for the first time, a special and hearty welcome. Our guest for the first segment this evening is a gem of our soil. Those of you who are Guyanese, Dr. Samantha Tross. I am not going to spend much time on an introduction. I will take a short break, and this afternoon is special. And I am very thankful that Dr. Tross has agreed to spend some time with us. So I'll take a short break. We are back, and the lovely lady next to me is Dr. Samantha Tross. Samantha, good evening and welcome to CWS. Can you hear me?
Good evening. I can hear you. I can't see you.
You can't. Well, you won't be able to see me this evening. I'm so sorry about that.
Oh, I see. Okay, that's fine. No problem.
Samantha, congratulations on all your accomplishments and much respect on being so determined and driven. So I want to lead in with this. Were you determined and driven as a child, or did it start later in life?
I think I've always been this way, but I think that we have to ask other people around me. As far as I am aware, this is how I've always been. So, I mean, that's my character. When I want something, I go for it.
So this determination and being driven and this drive, who do you believe is responsible for this?
Gosh, that's a difficult question. I think that it's to some extent inherent. It's someone's natural personality, and of course that can be honed by people around them. So, for instance, my parents were very encouraging, and I felt that there was an expectation of me to achieve,
Uh huh.
and therefore, I went about trying to do that, trying to excel, because that was always their motto: try, do your best. That's all they asked of us, was to do our best.
What are two things that always come to mind whenever you think about where you are today as a black woman and in
Mhm.
your career?
Two things. Well, I'm certainly grateful, um, and I'm lucky to say that I'm actually quite happy and content with where I am at the moment. So maybe those are the two things I would say.
If you were not a surgeon, what career would you like to have attempted?
Ooh, so now you've got me. I've always wanted to do medicine, so I've never seriously given anything else any consideration. But I was always very good at maths, so perhaps I would have been doing finance, something in the city. Uh, yeah, something in the financial industry, perhaps. But I've never given anything else any other consideration. It's always been about medicine.
I want to go back into your timeline a little.
Okay.
Can you give us a glimpse into your life as at the ages of 9 and 15?
Well, at age 9, I was in Guyana. I was a pupil at St. Gabriel's Primary School. Very happy in school, performing well, and I guess even at that age, considering medicine, because my father tells me I was 7 years old when I said to him I'm going to be a surgeon when I grow up. I have no idea where that idea came from.
Hmm.
Maybe it was from reading. I was a very avid reader, and maybe I read about medicine in some book, but also I had a lot of elderly relatives that lived with us, and my grandmother and my father's aunt both died whilst they were in the house, and I was very young at the time. So that must have had an impact. So at 9 years old, just getting on, doing well in school, and thinking of perhaps pursuing a career in medicine. At age 15, I was in the United Kingdom. I came to England at age 11. My father was working with the Commonwealth Secretariat, so he used to come into Africa. And because he was going to be moving from country to country, he sent myself, two siblings over to the UK to come to boarding school. So I was in school at the time, and again, I remained focused on medicine as a career. And so at age 15, I was preparing for my A levels in anticipation of getting to university.
Hmm. So tell us, what was that like when you first arrived in England, and what was the adjustment like for you?
It was difficult because not only was I in a foreign country, a different culture to what I was used to, but I was away from my parents. And yeah, it was very traumatic in many ways. And in some, I mean, perhaps it still has an effect on me. In some ways, uh, it made me very, very independent, fiercely independent, and that has had a positive and negative impact on my life. Um, so that had an impact in that way. Um, and it forced me to be able to get on with people. Because when you're there in a school, away from your parents, you got to survive. So survival skills, being able to interact with others, and independence, all attributes which have supported me in my career.
These two cultures, Guyana and England, what have you learned from either culture that helped to shape who you have become as a woman today?
Growing up in Guyana, there's very much a sense of family. And at the time when I grew up, I don't know what it's like now, but there was very much a sense of, when I say family, there was the inner family, the core family, and the extended family, aunts, uncles, and so on, and even just friends of the family that we call auntie and uncle, who looked out for you and were there to support you and nurture you. So for me, that's the fundamental sort of association for me with Diana, this family. The United Kingdom, it's things have changed because when I first arrived in the United Kingdom, they weren't. It wasn't so culturally cohesive as it is today, and so that I found very difficult. And there was definitely a sense of isolation, as I said, because I was away from my family, and then coming over to England with a Guyanese accent, I got a lot of tantalized, as they say. It was constant at the time. Um, and that made me stronger. So but now the culture in England is I enjoy being here. As I said, there's a cultural variety, and there's much more of a sense of cohesiveness than there was when I first arrived in 1970.
Mhm. Um, Growing up, your parents, do you recall any special words of wisdom th- um, that still resonate with you today from your parents?
Try do your best. Whatever you set out to do, always give it your best.
Do your best.
Yes. At the end of the day, sometimes things don't work out. But if you know you've done your best, then you feel good in yourself. You can only do your best.
What comes to mind when you think about Guyana, Samantha?
I had a great time growing up in Guyana. I had a wonderful childhood, and for that I'm very, very grateful. It was a sense of freeness. I don't think children growing up in Guyana have that now. When I go back to Guyana, I go visit my parents who are still there. The place is much more built up. I mean, between my house and the next house, there were hardly any houses in Lamar Gardens where I grew up. But we were very close in neighborly, even though we weren't directly adjacent to each other. Now there's house upon house. So there was that freedom. We as children would go off. We'd have our bush cooks. Um, I don't know. I mean, it was great. It was very much outdoors. You know, there wasn't much television, so we were always outdoors playing games, doing things outdoors.
You
And
you
uh,
you mentioned your aunts early on. Who are some women that you admired and looked up to as a child?
gosh, specifically, um, I can't. I mean, everyone that I came into, I always take something positive
Uh huh.
from everyone that I come into contact with. So I can't give anything specifically.
Right.
My mother, but certainly, my mother is a very, very strong woman. And sorry, oh my goodness, I'm so sorry with that. Can you hear that echo in the background?
No.
Okay, that's good. I'm glad
Okay.
you can't hear it. No, so I think the most influence has to have been from my mother. She was very much a career woman, despite having the children and so on, and she still managed to continue with her career. And she also, like my father, taught us the importance of education.
What is your favorite memory of her?
Oh, Oh boy, my favorite memory of my mother. There's so many memories, man. That's a difficult question. My favorite, I can't think of a favorite. There are too many.
If you were to eavesdrop your parents telling a stranger about you, what do you think each of them would say?
Strong-willed, um, uh, independent. My mother might say moody.
They say what?
Moody. um, oh gosh, I like to say that they think I'm loving, I'm caring,
Uh,
and loyal.
Loyal.
Hmm.
Oh. So what prompted you to specialize in orthopedic surgery?
Well, when I was training, I set out, as I said, at age 7, saying to my father, I'm going to be a surgeon when I grow up. But of course, I was one of these people that, as I went through the surgical training, the medical training, I should say, every specialty appealed to me. So at one point, I was going to be a psychiatrist, I was going to be a cardiologist, and so on. But finally, I decided that surgery was for me because what I like from surgery is that you get a quick there's quick feedback in a sense, It depends, of course, on the branch of surgery, but in surgery, generally, there's a quick turnover. You treat the patient, they move on. Whereas in medicine, they had these chronically ill patients. I realized that I actually like the constant stimulus from surgery. So orthopedic surgery I chose because the first female surgeon I ever saw was an orthopedic surgeon, and so that was very impressive to me. The surgeons that I trained with, of all of them, the orthopedic surgeons were the most fun to be around. Orthopedic surgery is one of those specialties which, depending on where you are, unless you're working in a trauma center, the orthopedic trauma can generally wait for daylight hours. It's not something you'd have to get up and do in the middle of the night. And that appealed to me because I'm someone who likes their sleep. I think it's so important when you're choosing the careers that you've got to know yourself. And what else? The orthopedic, the technical aspect of it, the tools and so that they're used, the fact that it's constantly changing and evolving, that appealed to me. So in the end, that's why I chose it.
Is there any particular advancement, any particular tool that or advancement in tools that you really like? Advancement in recent years.
There's lots going on. I mean, I specialize primarily in joint replacement surgery of the hip and knee, and prostheses are changing. The types of materials are being used. The instrumentation to implant the prostheses is improving, and there different things are being looked at. Looking at saving the ligaments within the knee, whereas before one would sacrifice the ligaments. So there's so many aspects to it that interest me. And the use of robotic instrumentation. There's lots going on, and this is why I love this specialty.
So you're constantly learning something.
Constantly learning.
So what did it feel like when you became the first female of Afro-Caribbean ancestry to become a consultant surgeon in the UK?
I didn't get the first part of the question.
What did it feel like to be the first female? Yes. Mm-hmm.
Well, look, to become a consultant was for me a great achievement. The fact that I was the first black female, that didn't really have a significant impact. I was more concerned about being a consultant. I'm thrilled, obviously, to be the first. I think it's sad in some ways that it's taken that long for someone to come along. But I didn't let that become a sort of a pressure, nor did I let it go to my head. It's an achievement. It's something that I was lucky to be in the right place at the right time. But I've not let that have a significant impact on me personally.
But did you ever feel a sense of responsibility for holding such a torch, though, that you're the first Afro-Caribbean?
Yes, it is a responsibility. um, and you want to make sure that you conduct yourself in such a way that when others come after you, that they want to encourage other women to get into the specialty and other black women, and also for the younger black women who are coming through now. I'm happy to say I'm there to support them in any way that I can. And yes, for them, they're very delighted to have me to look up to. Because that's important. It's important to have a role model. But you know, the role model doesn't have to be someone who looks exactly like you, because I didn't have that. But I had a lot of positive role models.
In addition to being trained in the UK, there's Toronto, Canada, there's Sydney, Australia. Which of these experiences was most challenging, and how did they prepare you for the challenges ahead?
Gosh, the I enjoyed both experiences tremendously. Let me say that. Um, the I guess perhaps Australia was more challenging because I was very far away from family, and where I was based, there weren't many black people around,
Mm.
and there was a sense of, what can I say? I was a little distressed at times when I saw the treatment of the Aborigines. Though I have to say, I myself was looked after extremely well. So just hearing some of my colleagues discuss the Aborigines and the way that they were perceived and treated had an impact on me from that point of view. But from how I was treated specifically, I had no problems. I had no problems in either Canada or Australia, although I was forewarned before going to Australia by someone who was a white British guy, who said to me, "I don't want to distress you, but you know the Australians are racist." But I have to say, I did not experience that. In fact, some of the kindest, thoughtful things that have ever happened in my life happened to me in Australia.
Wow. So when did the consulting phase of your journey begin?
When did it begin?
Yeah.
I've been a consultant now for 10 years.
Mm.
Mm.
And what was the trigger? How did that happen for you?
Well, you know what happens is you go through a training program, and at the end of your training program, you were eligible to apply for consultant jobs. So I had finished my training, and I was fortunate enough that I got well, it was the second job I applied for actually. The first one I applied for, I was myself and one of my best friends competing for the job, and he was successful at the job. I got good feedback from the interview. They were saying that they're sorry they didn't have two posts. And within weeks, I applied for the second one, and I got that job. So I was lucky because you know sometimes it can be very difficult to get a consultant job.
Ah. So is there a particular challenge in your early days as a consultant that you care to share with us, or was there none?
Oh yeah, well, there were definitely lots of challenges. I mean, the thing is, the challenges, luckily, weren't surgical,
Ah.
and that's because I had a good foundation and a great training. The challenges came from dealing with people, but that's something you got no control over. And in my very first job, I had in orthopedics, most of the trainees are male, so I had a male trainee who didn't take kindly to having a female consultant, you know, a female boss. So that was my most difficult aspect of the job when I first started, dealing with this unruly individual. And unfortunately, not getting really the support from my male colleagues because, of course, their interaction with him was totally different. So when I would sort of say, look, this is how the chap is acting, they would say, well, they don't see any of that.
Wow.
That was difficult.
Hmm. What do you remember the first time you performed surgery on a patient?
Excitement.
Uh huh.
And then it's so funny because I recall that there I was with my boss, and he gave me the knife, and I cut straight through the skin. I was down deep into the muscle, and he was like, "Okay, look, okay, you need a little bit of restraint." Normally, most people that get a knife, they're shaking and they don't want to even cut the skin. I was just going, you know, going for it. So he had to restrain me a little bit. So I was excited.
So tell me something, Samantha. What are people surprised to learn about you when they get to know you?
Well, I mean, what people say about me, which I like, is that they sound down to earth. And
That
that's what I am,
sorry?
you know. What is a surprise? People normally mention that I'm down to earth, and they don't expect me to be that
Yeah, that's true. I had that experience, I must say.
way.
So for the young people who are listening, young women who are young ladies who are thinking about medical school or medicine as a career, what challenges did you have prior and during med school?
Well, it's a long training program,
Uh huh.
and it requires. Look, you got to obviously the fact that you got into medical school means you're bright enough, and you got the tools to be able to get through the training. But you need to be consistent, and it's difficult when, for instance, when I went to medical school, most of my friends were non-medics. And so when I was there and they were out enjoying themselves, I was there getting the books. And there were so many exams to be taken, which other people didn't have. So that's a difficult thing. You have to have the willpower, the staying power. So that's a challenge. I think the duration of the training and the intensity of it. Um, if you, but I think if it's something that you want to do, I think you should definitely pursue it. I think surgery is a fantastic career, and I can't talk about other countries. I can only speak for the UK, but there is flexible training. So there's no reason why if you want to have a family and so on, that you shouldn't consider career in surgery. So you can do part-time training, and then when you get a consultant job, you can do job sharing. There are lots of different things being put in place to encourage more women into specialty.
Last question before we go on the break. What is the least helpful career advice anyone has ever given you, and how did that motivate you?
You know what? There's nothing that's been unhelpful. I can say there have been some negative career advice, but it's never been unhelpful. What I would say to anyone listening is, you've always got to take the positive from whatever situation is presented to you. So I did have someone say to me, you sure you want to do surgery, as a black woman, I mean, I think they thought they were trying to be helpful by pointing out that they would, it could potentially have been a challenge. I saw that as very negative, and I thought to myself, look, I don't need you to point out to me I'm a black woman. I can see that when I look in the mirror every day, and there's no reason why being a woman means that I can't pursue a career in surgery. Also, there was a time when I was deciding to specialize, and I wanted to do hip and knee replacement surgery, and that was considered to be a very sort of male domain. And I was encouraged to do hand surgery or pediatric surgery, and that annoyed me. And I'm the kind of person, if you tell me not to do something, I'm sure as hell going to do it. So, in a sense, that none of these comments were discouraging to me; they're only motivating.
All right, let's take a break.
Thank you.